watching Morning at NTV.
Welcome back and thank you for staying with us right here on Morning at NTV. On this conversation, we are going to be talking about combating COVID-19 and the lessons from HIV and AIDS fight. What did we learn from the HIV and AIDS fight, and what can we actually borrow from that fight to implement as a measure to combat COVID-19? Well, the news about the coronavirus is indeed of great concern for all of us and keeps changing almost on a daily basis. However, there is no data about how it affects people living with HIV. There is no evidence to suggest that positive people are at risk of getting infected with the virus. However, it is one of the things that keeps coming up every time the COVID-19 outbreak in sub-Saharan Africa is mentioned. To talk to us about HIV and AIDS prevention in the era of COVID-19 and what we can learn from our HIV and AIDS fight, we have the man on the front line of Uganda's HIV fight. That is the Director General of Uganda AIDS Commission, Dr. Nelson Musoba, and he joins me right now via Skype. Dr. Nelson Musoba, if you can hear me. Yes, there you are. Dr. Nelson Musoba, a very good morning. Dr. Nelson Musoba, if you can hear me. We are still getting that connection right with Dr. Dr. Musoba, but then we have verifiable information that 500,000 people have actually gotten infected with the coronavirus. 23,000 people have already died from the coronavirus. It has affected over 196 countries all over the world. And I'm telling you, no one is immune to the coronavirus. One single cough can actually release 3,000 respiratory droplets of the COVID-19, and one single uninterrupted sneeze can actually release 30,000 respiratory droplets. So that's why we encourage you to always use a tissue when you're coughing or sneezing, so that you actually reduce on the impact of that sneeze, so that you stop it from traveling. Remember, if it's not covered, an uninterrupted sneeze can travel for 60 meters. And remember, the World Health Organization is telling us to be 3 meters apart. So imagine that, 60 meters, one person can infect the whole room unabated. So there you have it. Sanitation is our best weapon in our arsenal against the fight against COVID-19 as we speak. We are taking a look at some of the stories that are coming in, but we are also trying to establish that connection with Dr. Nelson Musoba. When we get it, we shall be able to get into that conversation. But as we get it right now, so many countries are grappling. You have Rwanda right now that has a case. You have Sudan. Sudan doesn't have a case up there, the north. But you have cases in South Sudan. You have a case in DRC. You have a case. You have a case also in South Africa. Yes, you also have cases in Tanzania. So there's so many cases, and I have Dr. Nelson Musoba right now. I don't know if you can hear me, Mr. Musoba, but how are we doing in the fight against HIV, and what did we learn, and how can we incorporate that to fight COVID-19?
Well, thank you for having me.
Yes, Mr. Musoba, we can hear you.
One key lesson that we learned in fighting HIV was the leadership. We know that leadership is key.
Go ahead, Mr. Musoba.
And how this should be prevented. And clearly, that seems to be taking the same line with the fight against the coronavirus. The second approach in the success against fighting HIV, trying to mobilize and work with people living HIV to see how they can enhance community and so that they can go out and spread the message of prevention against how people can prevent themselves from getting infected with the coronavirus.
How can this group of people protect themselves from contracting the COVID-19 in this regard?
Say that again.
Dr. Nelson Musoba, if I'm living with HIV and AIDS in this era of COVID-19, how best can I protect myself?
If you're living with HIV/AIDS, you still need to take, the basic prevention measures. Practice social distancing. Make sure that you are washing your hands. Keep away from the crowds, but also keep on your medication, because if you're a person living with HIV, it's very important that you take your medication to keep your viral load low, but also keep your immunity up. So that would mean that ensuring that you have the adequate stocks of your medication, and the current guidelines that have been provided for social distancing, of keeping away from the crowds, washing your hands, and sanitize. Should you have any flu-like symptoms, then report those to the Ministry of Health using the toll-free lines that have been provided.
And also, Dr. Musoba, the World Health Organization HIV treatment guidelines now recommend multi-month dispensing of 3 months or more of HIV medicines for most people at routine visits. But we are not seeing this being implemented in most African countries. What could be the problem, and what ramifications can come out of this? Mr. Musoba, if you can hear me. Yes. The World Health Organization. Did you hear the question? Mr. Musoba, can you hear me?
I missed the second
yes,
part of your question, but
yes, I can rephrase. The World Health Organization treatment guidelines now recommend multi-month dispensing of 3 months for HIV treatment, but we are not seeing this being implemented in most African countries. What could be the problem, and what could be the immediate ramifications in this era of COVID-19?
The Ministry of Health had actually put down guidelines for what they call the differentiated service delivery. It means that you see each patient based on their specific needs. So you do not have to make the people living with HIV come to the health facility unnecessarily. And based on the stocks that are available, our health facilities are beginning to implement, the WHO guidelines, meaning that as much as possible, they will give the quantities that allow HIV positive people to stay away and only come to the facility when it is extremely necessary. So those guidelines are beginning to be implemented now, but it varies from facility to facility based on the stocks that are in place. But as much as possible, the health workers are beginning to implement the WHO guidelines.
Which other group of people are at risk of contracting COVID-19?
Those that are at greatest risk are the ones whose immunity is low, but also those who do not observe the WHO guidelines. It means if you travel to the high-risk countries, then you are at higher. If you recently traveled to the category 1 countries, then you are at the most highest risk. If you are in touch with somebody who has traveled to the category 1 countries, you are also at very high risk. If you should avoid crowds, but also if your level of immunity is not at the level that, the virus is down.
Dr. Musoba, I'm afraid that the link broke while you were still talking. Could you please rephrase what you were saying?
Well, The response to your question of who are the people at highest risk of contracting the coronavirus, in terms of people living with HIV, I said that those who are at most risk are ones, if you recently traveled to the category 1 countries, then you are at high risk, and it means you need to go and have yourself checked. 2, if you have been in contact with somebody who traveled to the high risk countries, you are also at high risk. You need to go and get checked. And then the third category is if your immune system is low, then you are also at high risk, and therefore you need to, take your medications, but also observe the Ministry of Health guidelines.
Mr. Musoba, all over the world, you have 500,000 people getting infected with COVID-19, but then you also have almost 115,000 people recovering from the same. Could you help us expound more on that to give our people a little bit of hope who are scared that maybe the COVID-19 is going to wipe out most of the population? Because we are seeing people recovering, especially in China, which has 80,000 active cases. Half of those people have recovered. Yes, how can you expound on that?
Fortunately for us as a country, we've not, we've had a slow start to, the infections. I know that by yesterday, the update was that we were having 14 cases and so far no deaths. And even when you look at the East African region and the African region in general, the rate of infection hasn't been as high as what it has been in China, Europe, and the United States. We are hoping that our epidemiological curve doesn't take that sharp rise as it did in other parts of the world. Exercises the precautions that have been given out, the precautions of, staying at home, keeping our social distance, and ensuring that we minimize the risk factors as much as possible. It should be it's possible for us not to experience the catastrophe that we've seen in parts of the world, especially China, Europe, and the United States.
I wanted you to expound on the fact that some people are recovering. How does that come about? And other people dying? Is it because of the immunity? We want you to explain that. The people recovering and the others dying. The dynamics around that.
We've seen from the other countries that the deaths have largely been, first of all, it has been explained that about 80% of people who get infected with the coronavirus will not require hospitalization. So only 20% hospitalization, and then 5% of those cases may become fatal. The experience in those countries has been people in other underlying conditions. If you have another disease condition, then you are at a higher risk of dying than somebody who is of the normal, is normal. So what the precaution we would give for our people again is those with any underlying condition should even take, much higher precaution.
Yes.
So, the rest of the population.
So Dr. Musoba, it doesn't matter if you're 96 or 21. As long as you have underlying health illnesses, you are at risk of contracting COVID-19 and exhibiting mild symptoms. Is that right?
Well, it should not necessarily be used as a magic bullet. Yes, if you have other underlying conditions, they will lower your immunity and will be more vulnerable to contracting the coronavirus. And once you do, your outcome is likely to be, not as good as somebody who is who doesn't have any other compromising condition.
We've seen what is happening elsewhere in the world. The infections are skyrocketing day in, day out. People are being infected by the hundreds every day. What are these countries doing wrong, or what did they do wrong that we can rectify right now and get ahead of the COVID-19 to fight it and curb it in its wake?
I think by the time that the countries took measures to either announce, lockdowns, put out instructions for people to stay home, and put their medical teams in motion, infection had widely spread. I think we have the advantage of starting early. We've taken measures of, the president has banned public transport. Most public institutions are functioning at, a very essential, only the essential staff should be traveling around. It's, other institutions should largely be closed. So I think we have the advantage of starting early. Most of those countries, by the time they put these measures in place, the infections had been widespread within the population. I think that's one of the reasons why we are seeing lots of, fatal outcomes in some of those countries. And we hope with our early start, we should be able to experience a better outcome than we've seen in those other countries.
But Mr. Musoba, they contend that the reason we are seeing so many infections in these other countries, especially Spain, Italy, the United Kingdom and USA, is because of the mutations of the virus. They contend that the virus is now airborne. But then you had the WHO country representative to Uganda, Mr. Jonas, saying that there is a small window that the COVID-19 could be airborne. I want you to expound on that. Is the COVID-19 airborne or not?
I think we do not have sufficient information for now. To what we've, the earlier data that we have is that it is largely spread through aerosol spray, so it means that you would have to have physically droplets within, either the sneeze or the cough that has come out and touch that. And once you touch your either eyes, nose or mouth, then you're able to transmit. So in terms of whether it is airborne for now, that data is not available. But any extra precaution is actually very important. But for now, we do not have the data to say that the coronavirus can be transmitted through, an airborne route.
Okay, let's take back to the conversation of HIV and AIDS and the precautions that people are living with HIV can actually employ in this interim to protect themselves.
Please say that again. I missed part of the question.
Let's get back to the conversation about HIV and AIDS and what this key population can do to prevent the contraction of COVID-19. Yes,
again, we are in talks with people living with HIV. We've asked them to take extra precaution. In fact, they are part of, we are mobilizing them to make sure that they put out information to the others, but also to the rest of the population, because in the HIV approach, the strategy of working with what we call experts within the groups of people living with HIV is a known strategy that we've used. So we've asked them, make sure that they take extra precaution, they practice, they implement the Ministry of Health guidelines. Their immunity is not is as much as possible put to the levels to where it should be. So mainly the message has been take extra challenge of with the public transport having been banned. It means that they have the issue of having to, for those whose pills run out, they have to travel to the health facilities to be able to replenish or access. So that in itself presents a challenge, but we are trying to work around that through, either at the local government level or working and seeing what means of transport is available there, and that if it can, the medications can be picked and distributed in an organized manner without having these people to come out and necessarily travel to the health facilities for their refills.
Of course, Dr. Musoba, in the past, people living with HIV and their communities have decades of resilience, surviving and thriving, and I think they can draw on their rich history and to support their families. But how best can they do that? How best can they draw from their resilience of fighting HIV to support their families right now? In a nutshell.
They are always on the lookout. In fact, if you look at there is a forum of people living with HIV. They are communicating with some of us, with the rest of the partners. UNAIDS, PEPFAR, the Ministry of Health is on that forum. We are working as a group as much as possible. Again, that joint multi-sectoral approach, using the experience of valuing every partner's contribution and, looking at every partner, knowing that every idea they bring is important. So again, it is the partnership, it is the togetherness, it is valuing everyone's opinion. That was an approach that made us successful as a country in the past. And it is what we are drawing on again. They are very interesting conversations. The challenges are being brought on the table, in terms of, the issues around the transport, the issues around refills. Some of them are already volunteering. Those who have access to personal transport are already, volunteering. And once they are reached out, they are supporting picking the pills and dropping them. And this, if that spirit of Ubuntu, as it were, is cascades around the entire country, the people living with HIV should be able to overcome, this temporary problem of the coronavirus.
Dr. Nelson Musoba, the Director General of Ghana AIDS Commission, thank you very much for your time. We appreciate it.
It was a pleasure having me. Thank you, Tom.
Well, the conversation has been largely centered around people living with HIV and how best they can prevent the contraction of COVID-19 in this era. Shutdowns, low supplies. How can you ensure that you get your supplies 3 months ahead so that you don't run out, just in case they extend the lockdown and so many supplies run out because we are not importing any more of these drugs? So there you have it. We have that conversation gone. We are going to take a very short break. We'll be right back with a lot more.